So my presentation is on pericarditis. Pericarditis is, in simplest terms, the inflammation of the pericardial layer around the heart. The etiology. So most of the causes for pericarditis are unknown, but what they do know is that it can be caused from autoimmune inflammatory conditions. If you have a heart attack, or if you require heart surgery, you can develop it after heart surgery. If you have an infection of any kind, either viral, bacterial, fungal, or parasitic. If you have an injury to your chest from like a car accident, or if you develop tuberculosis, it's actually really common to then develop pericarditis, and a more serious form of pericarditis called constrictive pericarditis, where your pericardial tissue gets scarred and it constricts your ventricles from filling as they should. Risk factors for pericarditis is if you have an unhealthy lifestyle, like you don't eat well or you don't exercise and you have a heart attack or heart surgery, that's going to increase your chances of developing pericarditis. Or if you have the autoimmune conditions I mentioned earlier, or if you're taking immune suppressing medications, that can allow for infection to come in and also develop pericarditis. An AI model that I found for this is called the digitized M-mode echocardiography. What it does is it is a potentially less invasive than the current surgical method of checking for either a diagnosis, or if you already have a diagnosis, checking the progression of constrictive pericarditis to see how the ventricles are filling despite the scarring and hardening of the pericardial walls. So for demographics, so it's most common amongst men ages 16 to 65, so it's a pretty large age range, though it is mostly men. Women can develop it too. There isn't any statistics on it affecting one race more than another. Most are only going to suffer a one-time acute pericardial episode, and it can last up to 3 months. About 9% of these patients who do develop an acute pericarditis can develop constrictive pericarditis, which is the most serious form of it, where you're going to have that scarring around the heart. About 15 to 30% of these patients who maybe start with an acute pericarditis will have repeat episodes, which then becomes chronic. And then for anyone who's been treated with mediastinal radiation, have a 2 to 30% chance of developing pericarditis. For the anatomy, your pericardial layer consists of your visceral pericardium and then your pericardial cavity, which is the fluid, where your fluid is stored. Then you're going to have your parietal pericardium and then your fibrous pericardium. And those lie most exterior to your myocardium and your endocardium, which are your innermost layers of your heart. And so when you develop pericarditis, your pericardial layers will become inflamed and they will begin to rub together, which will cause a fluid buildup in the pericardial cavity. So for physiology and symptoms, so physiology is that your pericardial layer is inflamed, and it's the sac around your heart. It consists most anteriorly of the visceral layer, followed by the cavity again, and the parietal and the fibrous. When one of the causes, maybe like lupus, occurs, the inflammation will cause the rubbing, which will cause the pericardial fluid to build up and potentially cause pericardial effusion, which puts pressure on the heart and when it's trying to beat, which is then causing cardiac tamponade. That's when a more serious complication can occur. If it's just acute, it's just going to occur once, last less than 3 months, and you probably won't ever develop it again. If you have chronic, it's going to last longer than 3 months, and it can lead to scar tissue forming, which then leads to constrictive pericarditis, and that inhibits the proper filling of your ventricles. They can't fill all the way, and it's going to cause pain and swelling and shortness of breath. Starting typically with mild to severe chest pains, you can also develop, again, shortness of breath, heart palpitations. You're going to feel weak and tired. You might start coughing, pain when you swallow, and then fever. So do it for diagnosis and treatment. If you're starting to feel those chest pains, obviously anything involving chest pain is going to be automatically listed as serious. So your doctor is going to listen with a stethoscope and listen. They'll hear a pericardial, what they'll call pericardial rubbing, where he'll hear the two layers rubbing together, makes a specific sound. It's then going to listen for excess fluid buildup in the pericardium, for the pericardial effusion, for all of the increase in fluid from the inflammation. After that, you're going to be sent out for an EKG, a chest X-ray, a cardiac CT, cardiac MRI. You also will get blood tests to see if you've had a recent heart attack, because that can be a cause for pericarditis. If you are diagnosed with pericarditis, treatment's going to potentially include antibiotics or other medications if the cause of it is some kind of infection like viral or bacterial, or fungal, parasitic, whatever it may be. And that can, if that is treated, the pericarditis can just resolve itself from that. It can also be treated if it's just an acute attack and there's no underlying infection. You can just get painkillers such as ibuprofen, or you might be given colchicine, which is going to reduce the inflammation in your body. If it's recurrent, chronic NSAID, if it's recurrent or chronic NSAIDs can be given to help, corticosteroids, immunomodulating medications. Those can all help with inflammation and the pain. If the pericarditis causes too much fluid buildup, you might need a surgery called a pericardiocentesis, which is going to be done to drain the fluid from around your heart and relieve some of the pressure. If it's serious constrictive pericarditis and you have a lot of scar tissue around your heart and it's affecting your ventricle filling and causing a lot of pain, they might perform something what's called a pericardectomy, which is when they remove part or all of your pericardium from around your heart to relieve any heart pain or complications from that. And that's everything for pericarditis. Thank you for listening.